Okay, guys, it's time.
Good afternoon. Thank you for joining us. Okay, the biology department welcomes you to our speaker series. Today we are partnering with Tropical Texas Behavioral Health to talk about overcoming anxiety during stressful and uncertain times. Our guest speaker today is Dr. Gustavo Force Rodriguez. Dr. Force Rodriguez has been a psychiatrist at Tropical Texas Behavioral Health for the last 2.5 years. Dr. Force Rodriguez has a bachelor's degree in biology from the University of Puerto Rico, Rio Piedras campus, and a medical degree from the University of Puerto Rico Medical Sciences campus. He completed his residency in adult psychiatry, and it is board certified by the American Board of Psychiatry and Neurology. He has several years of experience in both psychiatric hospitals and outpatient settings. So thank you, Dr. Forrest Rodriguez, for taking time to speak to our students and our community about this important and current topic.
Thank you. Thank you, everybody, for joining. It's an honor to be here and to discuss such an important topic in a time when it's needed the most, right? It's been a difficult year for most of us, perhaps for everybody. And we believe it's very important that we discuss this topic about anxiety and how to cope with it in times when it's needed the most. So first of all, the objectives of the presentation will be to define anxiety. In my practice, I often encounter people that perhaps, sometimes they tell me that they don't know what anxiety is, or perhaps they know it through a different, different word or a different term. So it's very important to exactly define what anxiety is and be able to, identify the possible causes of the anxiety, identify and learn how to actually identify the anxiety in yourself and others, perhaps some family members, and if you have children and your children, and elderly, and especially those that are more vulnerable. As part of obviously coping with the anxiety, it's very important to review home remedies, tools, techniques, and including exercises and diet, etc., that can be used to cope with anxiety.
Is it going?
Yes. All right, so what is anxiety? So anxiety mostly is a feeling of worry, nervousness, or unease that is typically associated with an imminent event or perhaps something that is uncertain, right? That feeling of uncertainty, of not knowing what is going to happen, is what mostly, affects us and cause us to feel that worry and that unease and that restlessness. It is often related to a sense of helplessness and losing control. It is one of the most common mental health problems in the United States. Actually, anxiety disorders as a disorder group, it's basically the most common disorder of anxiety. It is estimated that approximately 31% of adults are going to suffer anxiety at some point of their lives. The World Health Organization even believes that there's approximately 264 million adults around the world that suffer from anxiety. Among those adults, the 63% of those are female. It's a disorder that for some reason affects mostly females over males. And it does sometimes require to seek treatment. So what can cause anxiety? Right. So perhaps most of you associate anxiety with negative things happening or events possibly happening. But have you ever thought that perhaps something positive in your life can cause anxiety? Well, we'll look into it right now. So school can be a certain stressor that can cause anxiety. And those that are perhaps in the university, academic performances, depending on your goals and when you want to go, if you want to study medicine, if you want to study nursing, if you want to study whatever it is that perhaps requires you to have certain grades, to pass certain class with, with a B or plus, etc. That could be a source of great anxiety. In those that are in school years, perhaps if they suffer bullying in school, definitely that could be a great source of anxiety to that child or that adolescent. Work can certainly be a stressor depending on your work hours. the amount of work, the workload that you have, if you work the night shift, or if you work 12 hours straight, or perhaps overtime often, etc., that can certainly be a cause for anxiety. Family can certainly be a source of anxiety as well, depending on mostly their expectations for you. So if your family wants you to study something in particular, or pressures you to get a job, or to achieve certain grades, etc., that can certainly be a source of anxiety. Finances, we're living in very difficult and stressful times. I'm sure most of you have either a friend or a family that have lost their job this year due to the COVID. They, perhaps their work hours have been cut, they earn less money, and they're, in a tight financial bind. That can certainly be a cause for anxiety. Emotional trauma, illnesses, for example, if you are diagnosed, or a family member is diagnosed with an acute, serious medical condition, perhaps cancer is one of the most common that can lead to great anxiety. Or if it's a chronic medical condition, chronic pain, diabetes, etc., it can certainly be a stressor that can affect you in your daily life. Marriage is one of those positive things that one believes that should be something that causes happiness. But, society has made us perhaps, want the best wedding, a great, great presentation, between cake, etc. And it is a source of anxiety due to the money it takes, due to the effort that you need to put into it. And perhaps something that should have been just happiness ends up being a cause or a source of anxiety. Divorce can certainly be a source of anxiety. Retirement is one of also those that should be something positive. A lot of people look into the future and say, I wish, I can retire at this time, or I can't wait to retire. But not necessarily it's the same thing for everybody. Everybody is different. And perhaps somebody thinks, what am I going to do after I retire? I can see myself working my whole life. I can't see myself just sitting at home and doing nothing. A promotion is another thing that is often celebrated by friends, by family. Everybody believes it's something very positive, but at the same time, it's often tied to perhaps, yes, more financial, remuneration. You earn more, but at the same time, you have more responsibility and more pressure from your own work, and that can certainly be a source of anxiety. The pregnancy or a birth of a child. Sometimes people, perhaps, yes, they're looking to become pregnant and have a child and form a family. But even those, they can suffer from anxiety, right? What am I going to do? Perhaps maybe they wanted it, but it came in perhaps in the wrong time, or what they believe is the wrong time. Perhaps, they recently lost a job or something like that. And now, a child is on the way. So that can certainly be a source of anxiety. Or if it was unexpected, certainly it could be. Environment, everything that surrounds us, natural disasters, wars, all these things that we see perhaps on a daily basis, or if not often. Especially this year, it's been a very active hurricane season. Hurricanes are a huge source of anxiety for many people. Religion, sometimes religion can be positive for many people through prayer, etc. But depending on your family's beliefs and your own beliefs, for example, your own sexual orientation or sexual identification, religion may not go hand in hand to what you believe or what you feel, and it can certainly be a source of anxiety. When you have a major performance, perhaps you have a recital, you have a job interview, you have a presentation, perhaps somewhat similar to this one, where you have to present in front of a lot of people, then that can certainly be a big source of anxiety. The news, especially this year, watching the news between the COVID, the politics, the hurricanes, everything, I often recommend my patients to perhaps not watch the news every day and just watch news two or three times per week. And that, that tends to help them a little bit to control the anxiety about, all the things happening in the world right now. And they can still keep up to date with what's going on with that amount of time they watch the news. The genes, certainly anxiety can be genetic. It can be, if you have family that suffer from anxiety, then you're certainly at higher risk than the general population to suffer from anxiety as well. Medication side effects, and not just medication, alcohol, as we will see soon, drugs, and even lack of oxygen, which is something that is mostly biological. So how can we identify anxiety in ourselves and others? So anxiety symptoms can be certainly divided into 3 categories: physical, psychological, and behavioral symptoms. Now, the physical and the psychological symptoms are perhaps the most easily identified and the ones that people look for help more often for, right? You can get physical symptoms like heart pounding, your chest beats really fast. You get flushing, shortness of breath, dizzy, you sweat, especially in the palms. You can get, sweaty palms. You have headaches, dry mouth, stomach pain, nausea, diarrhea, muscle pain. It's not here in this list, but even tingling sensations, perhaps on your legs, your arms, or even your mouth or your tongue. And that could be a sign of anxiety. With these physical symptoms, people often go to the emergency room, a lot of times thinking they're having a heart attack, they have chest pain, their heart beats fast, they feel that something really bad is going to happen, and they seek emergency treatment. Psychological symptoms could include excessive worry, irritability, being impatient, feeling like you're on the edge all the time, feeling fatigued, nightmares, or dreams that are completely, people often tell me it seems so real. That's something that can certainly be a source of a symptom or a sign of anxiety. When your mind races a lot, or on the contrary, you go totally in blank. If you're feeling mostly indecisive, you don't know exactly what to choose, what to do. If you suffer from anxiety, this is going to be more common for you. You're going to have a lot of difficulty choosing between 2 things, and it could be just even menial things. It doesn't have to be a huge decision in your life. You can have difficulty concentrating, decreased memory. And then there's the behavioral symptoms, which are the things that you manifest when you suffer anxiety. For the behavioral symptoms, let's take a different look, right? So we can view anxiety as an iceberg, right? So what you see is basically the behavior. This is particularly useful when you're trying to identify anxiety in children, or those that are perhaps, those in need, people with autism, or the elderly, or people that can, in fact, not properly explain what is going on. I cannot tell you, I feel overwhelmed, I feel helpless, I feel restless, I'm continuously worried. Perhaps they don't know, any of those things. But they perhaps, overreact. They're always, either breaking stuff or shutting doors very abruptly, or kicking stuff, or just, having tantrums, or avoiding going out, or they have a particular change in their behavior. For example, in kids, all of a sudden, maybe they like going to the school, but now all of a sudden they just more close to themselves, more isolated. They try to perhaps show an excuse to basically say and avoid going to school. So that's something certainly that you can look at. So let's talk about anxiety in the year 2020. Obviously, COVID and politics are the main sources of anxiety, perhaps, in this year. Like I mentioned, hurricane season has been pretty active, and that's, like I mentioned, it's been another source. So in terms of COVID-19, I think it's really important that we discuss several things that can certainly be a source of your anxiety. Basically, when we talk about COVID, and since the pandemic started, places started shutting down, people started not having work. So little by little, you fear yourself perhaps of losing your job, earning less money, your job closing for an extended period of time. You're getting delayed in terms of your payments, of your mortgage, your your car payments, etc. You can start worrying about all these things, or perhaps somebody close to your family, or your son, your daughter suffer through this, and you feel the responsibility to help them out, but at the same time you're insecure. But this insecurity, they say that this is something that it's unprecedented, and for most of us it certainly is. The last time something like this, perhaps, or something similar happened, it was in the year 1918 when the Spanish flu happened, right? So unless there's somebody older than 100 years watching this presentation, perhaps all of us, this is something new for all of us. Masks can certainly be a source of anxiety for many reasons. You may feel shame, you may feel vulnerable, insecure, in the sense that, your body perhaps may be frail. You're perhaps afraid of, especially if you're either on college or in school, you're afraid of others mocking you or identifying you as weak. You can have that perception, even though a lot of people have mentioned that the levels of oxygen remain the same. Sometimes you do feel like you have a little bit more trouble breathing. And if you let that get to you, you start getting restless and more anxious. You start breathing faster, and that certainly, it's counterintuitive, right? You're going to start breathing more. It's going to be more difficult. And hence, since it's a little bit restricted, the breathing, it's going to be more difficult. It's going to be a bigger source of anxiety. Another important aspect with the COVID-19 pandemic in terms of the anxiety is the lockdown, the lockdown fatigue. Now, how many of you like to be told what to do? So I believe almost nobody likes to be told exactly what to do, right? Especially if it's, the government or something like that telling you need to stay home. There's that defiance that perhaps, thrives in a lot of people. And that's in part one of the reasons, or one of the problems that we're having in controlling the pandemic. Being cooped up in the house for an extended period of time, perhaps you share your house with a lot of people, perhaps there's not too much space, and it's difficult, and it brings you anxiety. It's a source of anxiety for you because you don't feel you have a place for your own. You don't feel that you can basically go somewhere and say, I'm gonna relax. I'm gonna stay, be calm for a few hours here, and maybe that's not the case in this pandemic. Homeschooling, it's a very significant source of anxiety for a lot of people during this pandemic. I often hear parents saying that math has changed a lot, and it's become more difficult, or perhaps more exotic. Also, basically, you may feel either guilt or worry, in the sense that perhaps you didn't do as well in school as you would like, or as you would like your kids to do. Perhaps you want them to, to be better than what you did in school, and you have trouble helping them achieve or take that step. Another source of anxiety, or the cause of the fatigue, it could be being sick, basically of obsessively cleaning everything, cleaning your whole grocery shopping, cleaning everything often in the house. You're washing your hands, cleaning everything that comes in contact with anybody external from your house, and that can be certainly tiring. Being cut off from social interaction. Certainly COVID has affected in many ways our life and how we interact with others. The dining, the eating out, it's not the same. Interacting with others mostly is now via videos, and there's not that close interaction that we perhaps had at one time. Like I mentioned earlier, feeling uncertain and anxious about your employment, your finances, worried if your job can afford having everybody and cutting losses. For example, if you work at a restaurant, 50% capacity, perhaps it's not enough. Maybe the owner needs to cut off a few employees. Not seeing an end to all these changes and to all these situations that's going on. I know that at least in the last 2 weeks, two good news perhaps have come in terms of a vaccine, 2 different vaccines that are on development with good results so far. So perhaps there's somewhat the light at the end of the tunnel, but it's still a source of anxiety, and a lot of people perhaps are not too optimistic about it. You can also perhaps go out and you can see perhaps a favorite place or a favorite restaurant you had closed down during the COVID, especially in the early times of the COVID, and how much your environment has changed since this started 8 months ago, at least here in the United States. Perhaps hearing of some people not doing the right thing. If you get into social media, you see people posting perhaps trips that they're doing. They're hanging out. They're on restaurants. They're drinking. They're in groups of perhaps 20 people, while you have been all these 8 months staying at home, keeping yourself and your family safe. It is certainly a source of fatigue, and it make you more inclined to perhaps just give up instead of continue doing what you've been doing and keeping yourself safe to perhaps help in terms of controlling this pandemic. And one of the most important things about the lockdown fatigue and the problems associated with it is the inconsistent messages that our leaders have often given us. It's often seen that, or at least for the last few months, it's been that it's almost scientists versus the politicians. The politicians are telling you it's safe to go out. It's just the flu, right? When it's in fact much more dangerous than the flu, right? It kills much more people. It's more easily transmittable, and the scientists know this, right? They do. One of the difficulties in people perhaps believing the scientists is the fact that they believe that their opinion changes often. It's not that their opinion changes often. It's that as long as there's research going on and new things and new developments are found, perhaps something is adapted or changed somewhat, and that's what basically affects that notion in terms of the expert opinion from the scientists. And it's also the amount of COVID information. There's a lot of wrong information out there. A lot of people just focus perhaps on what their family told them on YouTube videos, on whatever they found on Facebook. I strongly encourage everybody to look into reliable sources, perhaps and specifically scientists, peer review articles, things published in scientific journals or scientific or from the scientific community, instead of just basically any video that you can download or watch in a matter of minutes. So how do you stay safe and sound during this pandemic? It's very important to stay connected. I know it's difficult. I know we're very social beings, especially from the Latino culture. It's very important to have that connection, that getting together and hugging perhaps and handshakes and all that. But it's very important to stay connected either through phone, text, videos, so that you can basically keep in touch with those around you, with friends, with family, and perhaps not feel so alone during this crisis. Perhaps take a walk. It's often, people often tell you, if you're anxious, go take a walk. And maybe at the time that it's not helpful. Maybe you feel aggravated by the insinuation that you're perhaps angry or whatever, but it does have its biological reasons, right? I mean, when you take a walk, there's certain chemicals in your brain that are released, dopamine, endorphins, and it makes you feel good and relax you. It does calm you down and perhaps even helps you with any mood situation like depression or actually the anxiety that we're talking about. So, social distance talk with neighbors and friends. I mean, perhaps it's not ideal at this time to be hugging everybody and offering handshakes, but you can certainly, if you keep your distance and perhaps wear your mask and take the adequate precautions, you can talk to neighbors. You can get together with the friends, perhaps at a parking lot or a park, and you can talk and have a nice time. And at least not feel so alone and be a little bit more at ease with this situation. I often encourage my patients to pick up a hobby. Arts and crafts are something that definitely are very helpful. But you can do anything from gardening, from crafting, from whatever it is, fixing the stuff around the house. You can certainly use YouTube to watch some videos and be able to do a lot of things. Maybe you wanted to, your whole life, you wanted to learn to play guitar or learn a second or third language. I think this is as good a time as any, perhaps the best time to do something like that. Will be a time where we should be staying home or taking precautions, being safe. And in fact, most of us are at home, either working in one way or another, etc. It's very important to avoid and limit stressful situations. Like I mentioned, the news. If you don't have to watch the news every day, I would strongly encourage just watch 2 or 3 days a week. You can still keep in touch with what's going on, but not inducing anxiety on yourself for many times. If there's a particular situation at home going on, somebody's fighting or somebody's basically, on top of you for some reason, yes, maybe just, taking a step away, taking that walk that we mentioned earlier. And it can certainly help with the control of the anxiety. It's very important to stay hopeful, to make plans, right? Like I mentioned, a vaccine is on the horizon. Treatments are actually getting somewhat better, but we can't give up right now, right? That's why we're seeing a spike in cases here in the Valley and in the United States, and actually even other countries are seeing the same spike. Perhaps staying optimistic. Yeah, you can plan perhaps in the future, taking that vacation that you perhaps may have canceled this year after the COVID started. So how do we manage anxiety, and what ways we can cope with it? So anxiety can be managed with lifestyle modifications, which include diet, vitamin supplements and herbs, or exercise. It can also be managed through relaxation techniques, meditation, and religion, among them. I'm going to talk about them as well. And you can also seek professional help, either with psychologists, psychiatrists, etc. So let's start with perhaps the most dreaded and perhaps the most hated. As doctors, we often bring these up in every appointment. So and you can see in the faces that they're not really liked. So diet, right? So what things should we avoid? It's not, in terms of diet, it's not only important to see what can I take to perhaps improve and help in terms of controlling my anxiety, but there's also things that you should avoid to further your anxiety, or especially if you're susceptible or you're stressed or etc. The first thing, and the most common ones, caffeinated products. I know people love coffee. They love energy drinks. If you're in the university, it's often they use both, or if not all of these. But if you suffer from anxiety, that can certainly be a source of anxiety. Caffeine can release norepinephrine. Basically, what this means is that it can make you jittery. It can make you start shaking, basically, and that produces anxiety. It can accelerate your heartbeat and further that anxiety. Energy drinks include Red Bull, Monster, NOS, Bang, 3D, Rain, and the list is quite long. I think every year they come up with a new one. Alcohol, perhaps a lot of people mention that alcohol calms them down, or they makes them feel better, and they often come to the clinic after they already have perhaps almost have a problem of alcohol or already in it. They recognize they're self-medicating with it and prefer to basically seek help in controlling their anxiety in a different way. But for example, you can perhaps drink alcohol, and in the moment you do feel somewhat better, but maybe if you stop the alcohol, once the effects wear off, you're anxious again, or even more anxious than you were when you started drinking. And this could be caused because, it can cause dehydration, which may trigger anxiety and as it increases your heart rate. It may also affect sleep. I know some patients have come to me and they'd say that it helps them sleep, but studies show that it could be actually quite the opposite. And if you don't sleep, it may certainly affect your mood and cause anxiety, cause depression, etc. Moderation is very key. Now, a lot of people ask what moderation is. So it's very different for men and female. In terms of the men, it's basically 2 servings of alcohol per day or 14 servings a week. And in case of the females, are 1 serving of alcohol a day or 7 during the week. A serving may be perhaps more or less an ounce to 1.5 ounces of a hard liquor, perhaps maybe around 4 to 6 ounces of wine, or even basically perhaps a beer. It's basically what a serving of alcohol approximately could be. Now, don't blame me. It's not me. That's basically what the recommendations from the medical associations recommend. In terms of foods, it's aged and fermented foods. What happens is that the bacteria in these foods, it breaks down the proteins, it releases histamine, and basically it can alter a lot of things, including inducing anxiety, restlessness, affecting your GI or your stomach processing, etc. So if possible, it's best if you choose fresh and whole foods. Sugar can certainly be a source of anxiety. I put some cupcakes here, but not necessarily it's just cupcakes. In terms of sugar, they mainly mention added sugar, which could be something that can basically be in many products, which could include anywhere from ketchup, cereals, anything that has basically added sugar, some juices, etc. If you drink the juice of the fruit right off, the source, well then, there shouldn't be a problem in that sense. But the added sugar on top of it can certainly induce that anxiety and the famous sugar high that a lot of people talk about. Trans fats are also a big source of anxiety and can also lead to depression as well. If your diet is high in trans fats, it can certainly be concerning. All right, so what dietary supplements can I use to perhaps improve and help with my anxiety? Zinc. You can obviously buy all these supplements over the counter, or you can just basically get them through the sources that I mentioned here, like meats, beans, nuts, and certain types of seafood like crabs and lobsters and whole grains. Vitamin B6. For example, from turkey, beans, potatoes, spinach, and enriched cereal grains. I know practically all of us will have our good fair share of this one in the next week. Vitamin B12, from meats, milk, and fish. Magnesium and vitamin E, you can actually acquire them through dark leafy greens, nuts, seeds, avocado, soybeans, and bananas. Vitamin D, there's a lot of vitamin D deficiency. At least I see it very often in my practice. The main source is the sun, but sometimes the sun here is too hot and we stay mostly inside, so we don't get enough sun. So sun would be a good source. You can obviously, like I mentioned, buy it over the counter, or you can acquire it from salmon, tuna, egg yolks, and mushrooms. Other supplements that I've seen in the pharmacies before are L-lysine and L-arginine, and may reduce anxiety. Now, these supplements, I strongly suggest, take in moderation, what's recommended perhaps, and you can still, it's a case by case. It could cause other things, perhaps, if you suffer from reflux, some of these can worsen your acid reflux. So it's something that you need to be taking into consideration and perhaps talking to your primary care doctor about it. So herbs, what herbs can I use? One of the herbs is kava kava. I put an asterisk here because a lot of people believe, since it's natural, it's healthy, it's safe, and not necessarily that could be the case. Although kava kava has been found to have at least a moderate improvement and result in improving anxiety, it could lead to liver failure, and it could be anywhere from the first 2 weeks to 2 years of treatment, with an average of approximately 4.5 months of taking the kava kava. It could lead to that. Another good natural remedy is valerian root. I often recommend these to my patients to treat anxiety, to calm down, perhaps, especially if the anxiety is so strong that it affects their sleep, and they're not sleeping, sometimes not even with the medications I give them. I suggest also adding the valerian root. Passion flower, although slightly less with less results than the kava kava, it could provide some benefit. Chamomile tea is something I often recommend. But like I mentioned, all of these you should talk with your primary care doctor. St. John's wort is another possibility of a herb that you can use to treat and manage anxiety. It also has an asterisk because it does have antidepressant properties as well, and it does interact with several antidepressants that are used to treat depression and anxiety. So, although they're widely prescribed as antidepressants and anxiolytic remedies, they can certainly interact with medications. And at the end of the day, it's mostly the scientific data mostly points toward the improvement or help in terms of depression, but it's very limited or not significant in terms of anxiety disorders. So another source, or perhaps another hot topic at the moment in terms of controlling anxiety, is CBD, right? A lot of people mention that they're using CBD oil. They perhaps decide even to stop the medications to use CBD oil. So let's talk a little bit about it. CBD actually is one of the almost 200 cannabinoids that are found in marijuana plants. It is one that is not psychoactive, unlike THC, which is the psychoactive component of marijuana. So in terms of safety, is it safe? Well, truth is that a lot of the products of CBD that come into the market are not FDA approved. So in fact, the FDA has issued a warning about most of this because people are using it without them being tested or undergone the safety requirements from the FDA. Is it efficient? Well, there is evidence that CBD may be useful in treatment of some medical conditions, for example, epilepsy, but there is insufficient scientific evidence to support the claim that it helps improve depression or anxiety. Now, this doesn't mean that it doesn't work or it's not going to work. I'm not saying that, right? All I'm saying is that it needs more evidence, right? There are actually several studies going on in the US and in other countries in regards to the efficacy of the CBD in terms of the treatment for anxiety and depression. But as to being able to recommend the scientific community or doctors, there's still not enough data for it. Exercise. All right, so exercise is considered to be or to imply a routine heart-pounding activity, and it's certainly recommended for all adults. The American Heart Association recommends at least 150 minutes per week, which is basically half an hour, 5 days a week of moderate intensity exercise, or 75 minutes per week if you have a very vigorous activity, like perhaps contact sports or running fast, etc. That gets your heart rate perhaps above around 140 or above. Then perhaps with 75 minutes a week, you basically complete your fair share of it. Physical activities or exercises include running, cycling, swimming, any kind of aerobics, dancing like Zumba, hula hoop, salsa, etc. Sports, it perhaps, and this time with COVID, it's limited, and maybe you can't get together with your friends and play basketball or other activities, but there are several of these that you can perhaps do on your own, either throwing hoops on your own, or maybe tennis, it's also, quite separate, quite distant. If you have a soccer ball and a net, you can perhaps, work that out and have some physical activity as well. So let's talk about the relaxation techniques that I can use to cope and manage anxiety. One of the main ones that anybody's going to mention you, either a psychologist or a psychiatrist or any caseworker, if you ever seek help, is the deep breathing, right? It shows the man's laying down here, but if you're in a place where you can't lay down, you're in a public place, you're in a hospital accompanying somebody or something like that, where I certainly don't recommend you lie down on the floor. You can do it sit down, right? And just, put your hands in your abdomen in a comfortable position, straight, right? And you can inhale through your nose, right? You can count slowly up to 5 while you inhale. Then you hold your breath, then count to 3, and then again exhale, counting to 5 as you release the tension, your oxygen. And you continue to inhale through the nose and exhale through your mouth for approximately 5 to 10 minutes. It's not a matter of perhaps, doing it so quickly. Perhaps, I know it's difficult in times where you're very anxious, but with each cycle that you do, you'll start feeling better and better. And by the time you reach 5 to 10 minutes, it's going to be there's going to be a significant improvement. You can also perform these exercises once in the morning and again before bed. You can get great results doing it this way. So another form of meditation is the yoga. Yoga is a practice of breathing, mindfulness, spirituality, body, and the connection among all these factors. It has 3 main components. A lot of you obviously know about the yoga. It appears to be safe and improve multiple parameters. And not only the improvement is not only from anxiety, right? It's a type of exercise and meditation. So since it's an exercise, it can also improve your cardiovascular function, your amount of your lungs function. So it's very good for your health overall. Some of the main techniques that can improve or have the best benefit in terms of controlling the anxiety is the Buddha technique and the progressive relaxation. Now, the Buddha technique requires basically or implies a technique using 4 yogic postures and using perhaps like a mantra, using the word like peace or shanti, and basically that's what it consists of. Progressive relaxation, it's a technique that focuses on slowly tensing and relaxing each group of muscle. It consists mainly basically of tensing your muscles perhaps for 5 seconds. Maybe you can start in your toes. You tense the muscles in your toes for 5 seconds and then relax for 30 seconds. And then you keep doing that basically to make, achieve an improvement in your anxiety by relaxing. Now, a lot of times, believe it or not, we think, you can say or think that this is just trivial, but more often than not, you can feel that you're, all of a sudden you say you're going to, you try to tense your muscles, perhaps mainly in your shoulders. And all of a sudden you notice that your muscles in your shoulders are already tense. So then what you have to do is relax your muscles of the shoulder and then do the progressive relaxation, right? It certainly takes time, right? Progressive relaxation is something that that requires you to dedicate time. Relaxation in general may not work for everybody. I mean, one technique may not be helpful for you, but it may be helpful for somebody else. The important thing is not to give up, right? It's just basically, if one didn't work, just move on to another one, try a different technique. Perhaps that's the one that's good for you. Another form of meditation that has very good results in terms of anxiety, in terms of well-being, is the Tai Chi, which is a mind-body exercise that originated in China, and it involves like martial art-like movements, meditation, and it's safe for all ages and fitness levels. It really is inexpensive. Like, you basically don't need to purchase anything. If you have a source or a video that you can watch at home and replicate the movements, That's practically all you need. And you can do it either indoors, outdoors. There's no real limit in that sense. It provides a decrease in stress, anxiety, and depression. It improves mood, your aerobic capacity, which is basically your cardiovascular and pulmonary functions. It increases your energy, improves flexibility, balance, strength. It really. So I have a video here just so you guys can see. It's a very short video, but it doesn't have audio. So as you can see, basically anybody of any age can certainly do these type of exercises. They really don't require much. They certainly are relaxing and they're slow paced. Perhaps you can encounter some that you may not do. You can do it as best as possible. It's not a complete requirement for you to do it exact same way. Especially if if you look in YouTube, there's a lot of videos from master yogis or other people that have been doing this for many years. Maybe something simple to start, and perhaps as you get used to it and get better at it, perhaps seek for more complex exercises or movements in terms of the Tai Chi. All right. So another form of meditation, and it's very, very important that we discuss, it does have very good results, it's mindfulness. Mindfulness is a very old technique, but has been applied to psychological health issues not so long ago. It's basically it's a basic human ability. A lot of people think that this is something exotic, but it's something that we actually all have. It's very important, in the fact or in the sense that it helps you keep focused on where you are, what you're doing, and brings everything to awareness. So a lot of times we find ourselves basically drifting off or not really there. Perhaps somebody's talking to us and we're just drifting off. We're trying to do a chore or an activity at work or something like that, and we're not completely focused on that. So mindfulness is a short exercise that you can perhaps do in between different events in your work, in your studies, and you can basically help. It can help you ground you in terms of being here and now and focusing on what's important for you at that same exact moment. It has been completely and thoroughly studied. It's a meta-analysis, which is basically the highest level of scientific evidence that you can find. Of 47 trials with 3,515 participants found that it has a moderate evidence of reducing anxiety. It can be done seated. It can be done walking, standing. It can be done basically moving. You can do it lying down as well, but it will certainly relax you and you may fall asleep. When I was in training in my psychiatry program, I had a supervisor, a mentor that basically quite often did these exercises with us. And we were sitting down, and it was quite funny because one of my colleagues actually fell asleep a couple of times doing these type of exercises. You can have, you can do it between pauses in your day-to-day life, like I mentioned. You can even merge it with other activities, particularly yoga, and you can do it in between. I always recommend my patients in terms of improvement of anxiety, especially if they want to stop taking their medications eventually. Obviously, I recommend they do it, as according to our plan, and we established in the office. But the first step to towards that goal would be basically combining meditation and cardiovascular exercise, which is what is going to achieve the best improvement and benefits in terms of that anxiety control. Other forms of relaxation or meditation or massages. The limitation or the main limitation here would be cost. Unless you have your own massage therapist at home, it could cost you quite a bit, and these are certainly difficult times for that. This is also an example of one of those things that perhaps it's not for everybody. I've encountered people that really don't like massages. They don't like other people touching them. So if this is not for you, then you just try some different form of meditation that could perhaps help you. Aromatherapy is something that a lot of people use. Mainly the one that's most commonly used is lavender to help relax. You can add it in your own office, in your home, to help you calm down and relax. Music and art therapy, like I mentioned, doing arts and crafts or knitting or stuff like that. I'm sure most of us have basically seen the benefits of music. Perhaps you're having a bad day and you just basically put your favorite music on, or a particular type of music, and you all of a sudden you're more relaxed. In my case, I if I want to relax, I do like, I'm a little old fashioned in that sense. I like classical music to relax. Biofeedback and prayer, it does help a lot of people when they start praying and relaxing. You can certainly interchange it with the other meditation exercises that I mentioned earlier. So I also have another video in terms of a mindfulness exercise, just because I really believe it's very important that we discuss and that you understand how good it could be. So I really encourage you from the comfort of your home or wherever you are to practice the exercise. I believe it's around 3 minutes. So let's see, these could, it's 3 minutes, but it could be done for more. You can do 5 minutes, 10 minutes, whatever you feel that's good and helpful for you.
Mindful breathing. Close your eyes and rest your hands on your knees. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you're comfortable. Take a few deep breaths. While you're breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall each time you breathe in and each time you breathe out. And just allow your breathing to be natural and relaxed. Now bring your attention to the feeling of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each time you breathe in and each time you breathe out. As you inhale, maybe your breath feels cool. And as you exhale, maybe it feels a little warmer. When your mind wanders, or if you become distracted, just notice what's going on in your head, and then gently bring your attention back to your breath, going in and out. Focus on the feeling of your breath and allow thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat, and open your eyes. Mindful breathing.
All right. So I really hope that you found that relaxing and that you can apply it to your daily life to help you out in terms of controlling your anxiety between work, study, at home, with your family. You can do this in groups. Like I mentioned, my mentor certainly did this with us. You know, we were sitting around in her office, and we did these exercises. And we often, especially during hard times or hard tests, we would ask her to do the exercise with us, and it was actually very, very good for us. So when do I have to seek professional help? Although it's the last part of the presentation, I do encourage you not to consider it the last resort. I believe that there's a lot of help out there that you can seek. It doesn't only consist of psychiatrists or medications like you have already seen. It's basically much more than that. There's going to be caseworkers, psychologists, a lot of people that can offer help. You can start with a psychologist if you don't feel comfortable going to a psychiatrist at first, or you are afraid the psychiatrist only prescribing you medication. I know that's one of the stigmas and one of the difficulties we encounter in our practice. I like to believe that we are not a last resort, or only when nothing else has worked. It could be used certainly as a preventive measure to avoid perhaps you losing that job that you liked because of anxiety, or you failing the class that you so needed to pass and achieve, so that you can get to that program, or like nursing, medicine, whatever it is that your goal is. So in order to explain when to seek help, remember all these symptoms that we discussed earlier? Well, when these become very, very severe, they affect your daily life. When they require you to either go to the hospital, or it causes you to leave your job early due to an episode of anxiety, or when it causes any type of dysfunction, or you feel that you cannot manage at all, then it's certainly even almost late for you, right? I don't want to say late, right? But it certainly is time that you seek help from a professional. I really hope that with this presentation, you can certainly seek help much earlier than this. When you start noticing a lot of stressors in your life, when you start noticing some of these symptoms, and you don't want it to get out of hand, reach out to that psychologist, reach out to the counselor in your school, reach out to someone that can perhaps help you or point you to the right direction. So where can I get help? In terms of South Texas College, there's the Counseling and Student Accessibility Service office. In terms of non-emergent, you can use your institutional email or call to this phone number right here. For emergencies, they all obviously, and not just them, everybody encourages you to call 911. You can also reach the South Texas College Department of Public Safety at 956-872-4444. You can reach out to Tropical Texas Behavioral Health, which is where I work. It provides services in Hidalgo, Cameron, and Willacy counties. You can make a non-emergent appointment. If it's not an emergency, you can call this phone number right here. If there is an emergency, you can certainly call the 24-hour crisis hotline to this phone number that I will also provide. If there's somebody from Starr County watching, although Tropical doesn't offer services in Starr County, you can certainly look for help in the Border Regional Behavioral Health Center. And this is their phone number, so you can establish and contact. to seek treatment. Questions?
All right, thank you so much, Dr. Gustavo Forz. We do actually have quite a bit of questions that were asked by various members of our audience during the presentation. And so we've kind of, there were so many good ones, and I really do wish we had time for all of them because there were a lot of really good questions, but I've kind of grouped them into some categories that we can ask. The first one, this question was asked by multiple members of the audience a couple of times. So Dr. Forz, what would you recommend to people whose schedules or routines have been offset by the pandemic? So, you know, they have different schedules from their families, or they were night shift, now they're day shift, they were day shift, now they're night, they're working various, you know, just their routine has been offset. What would be a recommendation you would give to them?
So one of the main recommendations would be, surprisingly enough, we're creatures of habit, right? So it's very important to, although your life may have been turned upside down or affected, it's still important to have a routine. I do encounter often that people, perhaps they will wake up maybe at 6 a.m. to go to work. Now they don't have to work, and they're sleeping until 12, right? So the more you sleep, the more you change your routine, the more your body tends to stay not active, the more you're at risk perhaps of having depression, of having anxiety. So it's very important to at least do something. Perhaps, yeah, you can maybe sleep a little bit longer. Maybe you don't need to wake up at 6 a.m., right? You can wake up perhaps 8, 9 a.m. and do something, right? Do chores around your house, you gardening, or you can read a book, or pick up a hobby like we mentioned. There's many things that you can certainly do to your liking that can, you know, while you stay safe at home, you stay still with a certain routine so that your body doesn't, you know, get all haywire in a sense, right?
Yes, that makes sense. All right, thank you so much, Dr. Force. Our next set of questions deal with anxiety. There were a lot of questions having to do with the nature of anxiety. So is it, let me see. One of our audience members asks, Abby G, hi doctor, are people born with anxiety or depression, or are they influenced in their personal experiences?
That's a very good question, and the answer is both. So, like I mentioned, there's a very big genetic factor that plays a role in the terms of anxiety. Like I mentioned, if you have the more family members that you have that suffer from anxiety, the higher you are at risk of developing anxiety yourself. Now, higher risk doesn't mean that it's a guarantee. It's not that it's guaranteed that you're going to suffer from anxiety. It's just that maybe your friend who has no family members with anxiety has a very low percentage, but maybe you have 15 times the risk of developing the anxiety, depending on how many family members you have. But what is going to perhaps trigger that anxiety is all that environment around you. Everything from your birth until the moment that you are right now. How you were raised, what things happened when you were a kid, if you suffered from bullying, if you didn't have a good time in school, if you struggle in terms of academic achievement, if you struggle at work, if you have many things on your plate, right? I often tell my patients that the more things you're trying to cook, something's bound to get damaged and something's going to spoil, right? So it's very important that to consider all those things, all those factors, but not to think that I'm already doomed because my mom or my dad has anxiety. You're at higher risk, yes, but that doesn't mean a guarantee. It means that yes, it could, depending on the things that happen in your life, eventually you could suffer from that anxiety.
Very good to know. Okay, so continuing on that vein, I'm going to ask two more. That we had so many questions on anxiety, but I'm trying to capture the questions that kind of help answer all of the other ones. So another question, this one's asked by Priscilla Resendes, is given how anxiety could make someone start to formulate tics from how stressed out they are, how would they be able to identify such anxiety-induced tics?
So that's a very interesting question in the sense that there are certain anxiety disorders that are really associated with tics. It's the most common one, perhaps, that I believe almost everybody has suffered is the one with the eyelid, right? In certain particular situations where you're very stressed, where you have a lot of anxiety, you have a performance showing, coming up, or a job interview, and they may even come in the perhaps in the worst of moments, you have that tic. That can certainly be a sign of anxiety. In order to identify if it is anxiety related or if it's something else, it's basically a matter of clinical assessment. With a clinical interview, if you identify other symptoms like the ones we mentioned, then there's a higher probability that it is anxiety related, and basically that tic is your body letting you know that you're having a lot of anxiety at the time, and that you perhaps should to try any meditation or some natural remedies, or, like I mentioned, to seek help.
I see. And so continuing on that vein, right, a lot of our audience members want to know how to help others deal with anxiety. So one question that kind of captures this is from Jose Gonzalez, and he asks, my question is, how can you cope with anxiety, or how can you help someone else cope with their anxiety?
Okay. So I'm assuming when they mention someone else, that they're talking about an adult. In terms of the kids, obviously it's going to be easier, right? If you're the father, you have the responsibility. You just take them to the doctor and see in what ways they can be helped. In terms of an adult, we as practitioners also suffer from that same difficulty. We can't force somebody to receive treatment. We can't force somebody to get help. Now, what I do recommend a lot of times is perhaps to incorporate that person to your routine. For example, if you yourself practice these type of things, either walking or some type of sport or meditation, etc., it would be good if you invite them to do it with you. Even if you don't do it and you actually want to help this person, then perhaps you can offer yourself, why don't we try to do this? Why don't we try to do this type of meditation, to go out, walk, do this type of exercise? Perhaps that could be the best way to help someone. Without directly saying, you have a problem of anxiety, you're very anxious, you're all over the place, you should go get treatment or seek help, which may certainly affect your relationship with this person, and they may be offended and perhaps not talk to you in a while. So instead, I do recommend that will be the best way to approach them and to help them out. Just offer that choice of doing a particular exercise or something that helps them in terms of anxiety. If they see improvement, then after that, they perhaps have built a better trust with this person, and then you can later on suggest, maybe I do suffer from that anxiety just as you do, and perhaps this tea has been helpful for me. Maybe you can try it as well. And since they trust you now, in terms of you basically offer to help and indirectly, without perhaps them even knowing, then you can help them later on in other ways by suggesting teas, treatments, etc.
Okay, that's good to know. And so you kind of answered this next question a little bit with your previous comment, but one of our audience members wants to know, MNC07, can a 2-year-old have anxiety?
Certainly. It's very, I'm not a child psychiatrist, but I can't answer that question. So it's a lot of people believe that just because a kid is very young, they're not going to suffer from this. Now, when you see anxiety or some type of disorder at home in a kid such a young age, it's very likely that they're in an environment that's very anxious, right? So like very, perhaps not necessarily chaotic, and doesn't even need to be the environment. It could even be the mother or somebody very close to them that are suffering from a lot of anxiety, and for some reason they pick up on it, and they are anxious themselves. So in that case, it doesn't necessarily mean they will need the treatment. Probably the whole family needs a more likely an assessment. Yes, you can take the child to the psychiatrist and perhaps have the evaluation. Hopefully the psychiatrist does an evaluation that includes how the whole family is and the well-being and how everything is at home, like I believe it should be. And it's able to identify, mom is very anxious, and I think your child is picking up on that. So, or grandma is suffering from a lot of anxiety with, with this virus. Or they're afraid of catching the virus and dying, or with this virus as well. You yourself are anxious because you're afraid of transmitting it to somebody you love, and this person suffering as well, or dying. And childs can certainly pick up on that. And it's something that's very, very important. Very good question.
Yeah, children are like sponges. They absolutely pick up on a lot more than we think they are picking up on. Our next question was asked by a variety of members of our audience, and it has to do with fatigue. And so Lily Morelos asks, what are ways to prevent fatigue and anxiety with virtual learning? So again, the change and shift from platform of learning, and I think also work, right? So what are some ways to prevent this fatigue and anxiety?
So in terms of preventing, it's mostly the same way as treating it, through meditation and mindfulness, all those things that we discussed. If you are not suffering it from it right now, you can certainly do them to prevent them. These are not just techniques or tools that you can use to treat the anxiety. They can also be used to prevent them. If you incorporate a routine of exercise, of meditation, etc., it can certainly help you perhaps let it go a little bit longer without you being affected, or maybe even not happen at all if you do it often and correctly, right? The biggest or the most important thing about this is that you need to do it regularly. Everything, like I said, this is not everything is just medication, or just because I'm a psychiatrist, everything's going to be medication, but everything will be sacrificed. You do have to give the time to do the exercise, to do the meditation, to take care of yourself. If you don't, then you basically your own body's going to tell you, you know what, you need to make time anyway.
So prevention is best, in other words, right? So taking a proactive stance to prevent the anxiety from becoming overwhelming, which is very difficult during these COVID times. So that brings us to our next set of questions. These were also asked by a variety of our audience members, and they have to do with the long-term effects of anxiety when it goes untreated, right? So, for example, T. Dong asks, what would be the negative impacts of the symptoms of anxiety if it lasts too long? And then another one of our audience members wanted to know, Anna O., my mom has anxiety and her biggest fear is that she can get sick due to her anxiety. Can anxiety cause a heart attack or any other serious medical issues?
So those are very good questions, and I'll try to answer them without being too technical, right? So anxiety, a prolonged period of anxiety tends to raise a substance in your body that's called cortisol. So your cortisol increases, and there's certainly going to be certain things in your body that are going to be affected. With extended periods of anxiety, a lot of people start complaining, my hair is falling off. My heart, I'm having issues with my heart. My blood pressure is spiking, it's going up. A lot of things can certainly happen if anxiety goes untreated. It's very important. That's why it's very important to prevent it. Like I mentioned, the prevention is mostly the key. Once you get it, it's as soon as you get it or you feel it, the sooner you treat it, the better it will be, because you will perhaps avoid all these long-term effects of the anxiety or those physical symptoms or causes that can happen. But in terms of medicine, the best way always is prevention. That's why vaccines exist. That's why you should have a yearly checkup with your primary care doctor. That's why, everything is a matter of prevention. It's better to, identify perhaps in terms of your primary care doctor, identify when your blood pressure starts going up and the doctor's saying, you know what, you need to add a little bit of exercise and improve your diet, or else you're going to have, we have to give you a medication, or then you're going to have, other problems, heart problems, etc. So the same thing in terms of anxiety. If you don't prevent the anxiety from happening or cope, in an adequate way, then eventually you will have to do all those things or receive medication, use other or use supplements, etc.
I see. So these next set of questions have to do with meditation. And so a couple of our audience members have asked, what do you do when you can't meditate? So you have racing thoughts and you can't sit still while you are trying to meditate. Your mind just keeps going somewhere else.
So that's why I put a big range of things in the presentation. It's, like I said, relaxation is very difficult. It's not going to be necessarily helpful for everybody. In like they said, yoga and perhaps Tai Chi, it's not static. You can do it, well, perhaps walking. Now, if that's certainly something that, even though you're still moving and not so, so still, like mindfulness or the deep breaths, then you're going to need a physical activity. You're going to need exercise. You're going to need to take a walk. Perhaps the more things that you can add to that walk, the better, right? I know it's difficult, but if you can add like a better environment or a relaxing environment, if you like, nature, you can take a walk in the park, or if you like the beach, taking a walk in the beach. I know it's it's not so close right now, but it's not too far either. If you want to have a day off and say, you know what, I need to ground myself again and incorporate myself to nature. The more you can do those type of things, perhaps even you can take a walk. If you're not alone, you can take a walk with listening to music. You can even take your own, your pets. A lot of people use pets and it helps them calm down. It's something that I forgot to mention, but it will certainly help. So if you go take a walk and you take your pet with you and you have some music on and you have a few things all together, perhaps it will be easier for you to control that anxiety, to manage that anxiety. And maybe after you calm down, then you can add the meditation exercise right after you were able to calm down. Because if you're able to calm it down in one way and you can add the meditation exercise afterwards, you're doing two things that will help your body manage that anxiety. And eventually the anxiety will be less and less.
I see. And so this one kind of helps bridge the next set of questions. The next set of questions have to do with medication for depression and anxiety. But I like this question. It was asked by various members of our audience. How do we distinguish between anxiety and depression?
So I'll try to be not so technical as well on this one. In practice, anxiety and depression really go very hand in hand. Now, to a lot of people, it may seem very similar. To somebody, a mental health professional, it is not. There are certain questions that they are going to ask you, and they will be able to differentiate. But they often come together. This is not, a lot of times it's not, the book presents you with, these are the anxiety disorders, these are the mood disorders, but a lot of times there's a mix of a few things. And the reason why anxiety and depression go hand in hand is because one of the chemical substances in the brain that causes depression, which is serotonin, is the main one for anxiety. So people who have a deficiency or an issue with serotonin in their body will most certainly suffer from both anxiety and depression at the same time. But if you go to hopefully either a counselor, a nurse practitioner, or a PA, or psychiatrist, psychologist, whoever works in the field of mental health, they will be able to differentiate both, or they will be able to let you know what, you suffer from this type of anxiety disorder or this depression, or you just basically suffer from such bad depression that you also have, it's causing you an anxious distress, causing you to develop certain anxiety symptoms associated with it.
Oh, so one can certainly lead to the other, in other words.
Yes.
Okay. All right. So this is a good transition for medication. And so one of the questions that was asked a lot was about BP medication. So Dr. Force, what is your opinion on BP medication being used for people who suffer from generalized anxiety? This question comes from Ariana A.
BP meaning blood pressure?
You know what? She did not specify, so I am not sure.
I hope it's BP medication calling blood pressure. So one of the main medications that do treat blood pressure and help, or I use often in the clinic to treat anxiety, is propranolol. It's very helpful in terms of perhaps controlling your physical symptoms associated with anxiety. If you have to give a presentation or you have a job interview, etc., it will help with the physical symptoms, but it will not help with the psychological symptoms that I mentioned. I didn't want to get too technical in terms of medication, but I'm glad that people are interested. So not all BP medications are going to be helpful, but in my experience, certainly propranolol, which is from the blood pressure medication family, it's a beta blocker. It's very good in controlling and managing those symptoms, particularly, fast breathing, palpitations, sweaty palms, shaking, etc. If you suffer from those physical symptoms, it can certainly help you, or even the sweating of the palms or your body, it can help you a lot in managing those symptoms, that particular type of medication.
Let's see. Our other audience member, BC Gum, asked, do you have any thoughts on the controversial drug kratom for stress relief, anxiety, and as an alternative for pain relief other than prescribed narcotics?
So I believe that medications has not, in terms of the treatment of anxiety, has not been, there's not enough scientific evidence, right? I know that a lot of people use, there's a lot of opiate use in the world, and particularly in the US. Now, opiates certainly will offer the main, how do you say it? The main use is going to be, control of pain and anything associated perhaps with chronic pain and all that. Managing or relaxing is basically a side effect of the medication. It can cause sleepiness, drowsiness, sedation. And a lot of people can certainly find it calming and relaxing. Now, in terms of use of opiates for anxiety or stuff like that, it's a very slippery slope, because it can certainly lead to certain, dependence, addiction, which is something that also happens with a group of family of medications that we use, which are the benzodiazepines. Mm-hmm. If you start using it, especially if it's not the intended purpose, or it has a short duration or short effect, the medication in your body, then you start ingesting more and more to control all those things, and all of a sudden then you have a different problem when you were trying to solve one.
I see. So these next set of questions have to do with alternatives to medication and also the side effects, I guess, of medication. So Belen de Leon asked, Dr. Force, what are the negative effects of antidepressants?
I'm assuming negative effects, they mean side effects to the antidepressants. All right, so there's several groups of antidepressant medications, right? Like I said, I didn't want it to be so technical, but so there's an old class or two old classes of medications, which are for those that like this type of stuff, they're called the MAOIs, which is basically they target mainly a particular set of proteins in your body to COPA receptors. There's the tricyclic, there's a selective serotonin reuptake inhibitors. There's the somewhat typical medication. So each one is going to cost perhaps something different, right? But you can divide it certainly in those groups, and depending on those groups, you can have side effects. Now, some of the most common side effects of antidepressant medications are certainly going to be headaches, stomach aches, dry mouth, dry eyes, constipation, nausea, vomiting. And if you're using any antidepressant, one of the biggest things would be, or that the FDA also mentions us to encourage to let our patients know that if it happens, they need to tell us. It's in those teenagers or younger than 25 years old. It's an increase in suicidal ideation. Although antidepressants are used to treat depression and treat these type of symptoms, for some reason they also help that for some reason they induce that type of ideas. It's more common in that group, but I've seen it also in people in their 30s. Most of the families of medication, of antidepressant medications, except just one, can also have sexual side effects. You can induce any kind of sexual side effects ranging from, difficulty to achieve arousal, not having any type of desire, problem with erections, orgasms, sensation, anything in the list of regarding your sexual activity, it can certainly affect it. And of course, a lot of times, everybody is different, right? And these are side effects. It doesn't mean it's going to happen. Like I tell everybody, but these are possibilities. If they happen to you, you need to let me know, right? It's very important to have that discussion and that open discussion and contact with your doctor. This is not working for me because of this and that, right? In terms of the sexual side effects, I tell my patients, I know it may be uncomfortable, especially when I have a female patient. I know it's uncomfortable, but it's something that's really important. If you feel this way, you need to tell me, right? And we're trying to solve a problem, not create more. So just let me know. But everybody is different. Even I've heard people that tell me, with the antidepressant, I got even more depressed. I don't like them because they make me more depressed. Now, another thing that antidepressants can do, and that's basically any of them, is if you have, that's why it's very important not to take medications from your family or anything like that, because if you have a family member or you yourself, turns out that instead of depression, it's, you have a bipolar disorder, then it can induce mania, or what we call mania, which would be the completely opposite side of the spectrum, which is instead of depression, it's an uncontrollable hyperactivity with a lot of things and a lot of chaos and symptoms that can happen. So in terms of medication management, it's really important to speak to your doctors about it.
I see. All right, Dr. Force, our time has really flown by. It's almost 7 o'clock, which is when our talk is scheduled to end. So I will just ask 2 more questions. I wish we had time for more questions because, man, some of these are really good. So our next one has to do with alternative medicine. So I'm going to just combine these two with my question is, can we use zinc and vitamin supplements, and do we get the same benefit from them? That was Esmeralda A. And then Enrique Olivares asks that they've noticed small amount of CBD stores opening in the Valley. How reliable would these stores be if some products are not FDA regulated?
Okay, so in terms of the supplements, one of the easiest way or shortest way, or the most recommended things would be multivitamin, right? You can take a multivitamin, something that you're probably most of the doctors are going to recommend. You can start adding to it or buy more, but at the same time, it can be counterproductive. A lot of times in terms of vitamins, my main idea in terms of the vitamins was that you have certain vitamins that you can acquire for certain foods. So the important thing is that you really need a balanced diet. Right? If you get a balanced diet, then there shouldn't be a need for you to be supplementing. Now, some of these vitamins you can identify through a lab work. Your main doctor can tell you. They can test for your vitamin B12 levels, vitamin D, and they can check if they're low. If they're low, you will have problems with energy, with motivation, with anxiety as well. So you in terms of combining, there shouldn't, you can combine it, but like I said, it's if it turns out that your body is actually producing the adequate amount, it's in excess, and it's you're just wasting money in that sense. So the ideal thing would be to have a more balanced diet. In terms of the CBD, I know that's why I added the slide of the CBD. I know that there's several stores. Like I said, it's not that it's not going to help. Some people have actually told me that they do receive some benefit from it. The important or the take home message in terms of the CBD would be to exercise caution, right? Some people come to me and they tell me, "Can I use this?" It's like, so I have to tell them, I can't recommend it to you because there's no scientific evidence for it. If you want to try it, you can try it, but be aware that anything that you put into your body can have an effect. It can have side effects of some sort. So, and especially if a lot of these things are not FDA approved. If it's FDA approved, it's just saying somewhere in the label. But like I said, most of them are not really FDA approved in terms of safety. So the important thing is to take just caution and to explore if you're going to explore, to be aware of your symptoms, of any side effects that may happen, of how it makes you feel. If it makes you more, perhaps it may make you more irritable, more angry. Stuff like that tends to happen even with supplements that you can take, or herbs or whatnot.
Okay. And so I'm going to ask one more question. I really do like this question to end our talk. What is the process at Tropical Behavioral Health to seek treatment for anxiety?
So in terms of treatment for anxiety, you can, like I said, there's the phone number was there. It's 956-289-7000. You schedule an appointment first. The process is a little bit tedious for some people, in the sense that it's possible that you will have to explain yourself a few times. The first, you basically schedule your appointment. You do a screening, or the caseworker does a screening, and then basically you're scheduled to speak with a psychiatrist, right? With the prescriber. The prescriber is going to ask you the same questions that perhaps either the screener, if it was a crisis, the screener asked you. Once you started scheduling the appointment, the caseworker to open your record ask you. And when you get to the doctor, well, you have to, it's your doctor, you have to say it again. It's a small price, in my opinion, it's a small price to pay for your well-being and your health, right? I mean, if you certainly feel that you need to seek help, I hope that it doesn't deter you from seeking the help, from seeking treatment. It's really important, and the more people know, probably the caseworker is going to be working hand in hand with the prescriber as well. So at some point they're going to need to know it as well, and it's better from the source anyway, right? So basically, it's just calling your schedule. You will get an appointment for an intake. They will do a few things, right? There's different departments. The financial department, they will assess if you don't have any money, if you don't have any income, etc. They will, there's basically federal funds available in the clinic to provide service to people with from low income. So that's really important. Not a lot of people know. A lot of people come to me when I ask them since when they've been feeling this way. Sometimes it's 6-7 years, and when you ask them why did you wait so long, it's because they didn't know that they offered Tropical offered services for people with low income. So it's really important to just open up, seek, and see if it's helpful for you, and look out for your well-being.
Yeah, I always like to tell my students that you have to take care of yourself, right? That mental health is very important. Thank you so much, Dr. Forrest, for this amazing talk. It's been very informative, and I sure hope that the members of our audience have been able to take a lot of useful tips and advice on how to manage anxiety and depression in this very difficult time. And to our audience members, I'd like to invite you guys to join us on December 1st for our HIV talk, right? To inform yourself and protect others. So that's going to be again on December 1st. Keep an eye out for our Eventbrite invitation, as well as subscribe to our YouTube channel so that you can go ahead and access the talk there. Dr. Forrest, once again, thank you very much.
You're welcome. It's been an honor.
All right. Goodbye, everybody. Have a great day. Take care of yourself, right? Remember to honor your mental health, because that's the most important thing that we have.